shoulder.
Ooh, Curzon.
And
okay, wait. 10 out of 10. Sharp pain radiates to my.
Right
Do I just say
scapula.
scapula?
Shoulder.
Shoulder. Okay.
Right shoulder in your back. Right?
Colostinitis, what is
And
that again? That's
Is that
spleen.
that's the gallbladder?
Gallbladder.
It's secreting.
yeah.
And this Curzon, right, going to the shoulder, radiating to the shoulder?
Yeah.
Curzon.
Good.
Why did I not hear about this yet? Alright.
Yeah, and you know what? There's tons of time. If you don't need to know, what you need to do is be able to look at the vital signs. Is this patient in shock? Not in shock? Because there's nothing we can do with regards what's actually going on inside. We can only treat the symptoms that are on the outside. So it's just doing a proper assessment. Shock, no shock, do I need an IV, pain control, and gravel.
Yeah.
These calls are all the same. Appendicitis, diverticulitis, cholecystitis. We treat them all the same. They're identical calls for the most part.
So,
all right, so 10 out of 10, sharp stabbing pain in your right upper quadrant to your right shoulder in the back. And how old are you? Oh, you're 56 years old. So you have to act really cool like me.
you're 56? You're 56?
Yeah, I am
Holy.
actually. I just turned 56 in February.
Holy crap.
Yeah,
Okay.
yeah. Pettigrew's way older than I am. Sharp stabbing. And it really has gotten bad just in the last 2 hours. 2 hours. And never had it before. You have a past history of non-insulin dependent diabetes mellitus. Type 2. Type 2.
Well, yeah.
All right.
At least I got something right.
And you take metformin.
Okay.
Is she a bit diabesity? Bit bigger?
Big.
Yeah.
Big?
Okay.
Diabesity.
Where do you want me to lay on this thing again? Or?
Actually,
You
if you
just
want
want
to
me to stand?
sit in a chair, or you can be standing, kind of pacing,
Okay.
if you want, in guarding. That's a great presentation. But yeah, bring a chair over as well, and I want to see whether they get you to sit on the stretcher or on the chair.
Hopefully it's on the stretcher.
Yeah.
Right, right.
So just move it. Yeah.
Part of the room now, you know? It's beautiful
Exactly.
furniture. Brings the room alive. So colonitis is inflammation of the gallbladder.
Yeah, like gallstones. 'Cause
Yeah,
it's like,
and it's caused by like stasis of bile or high cholesterol, which if you're a bigger person, you might not. You're eating fries underneath the fridge, you know?
greasy food.
Greasy food.
Yep. You got there's the pattern.
Alright.
So I got you a med list and there's a health card here. Don't offer anything unless they ask.
Yep.
And you can send them.
Can I say shoulder pain?
Well, then
Nah.
he's gonna come in here and
Just
he's gonna.
make up an address code for a 56-year-old female patient, severe abdominal pain, just like the other ones.
Sorry, is she underneath the bridge right now? Is that-
No, she's home,
She's home.
back home.
It's like
So the bridge.
9 at night.
Code 3.
And tell them it's time of day except PM instead of AM.
Okay, and you're 56.
Yeah.
Damn.
Alright, we called code 3 to a patient's residence, 36 Lampton Boulevard, and patients complaining
broken
of
dreams.
severe abdominal pain, 56-year-old female, severe abdominal pain, code 3. The new one. You got it. Alright, you're good.
Yep.
I don't know what I have.
Look at that now.
Got it?
Yep.
Alright, let me know.
Okay.
You good? Alright, final 3. 1, 2, 3. Keep walking, that might make it feel better.
Shut up.
All
It hurts.
good?
Yep.
Alright. Hi, so
Wow.
again, my environment is a residence. Mechanism of injury currently unknown. Casualty is one 56-year-old female patient. Additional resources not needed at the moment, but I'll call if needed. And the same height, okay? Down.
And one thing you notice about your patient is that they are a little bit on the large side, probably at least 100 kilos.
100 kilos.
100
Wow.
kilos.
What is that in
So that's like
pounds?
220.
220.
Oh,
So,
wow.
I'll say one,
I should
two,
go
three.
for a run.
There we go. Can we start unloading the bags for me?
Oh,
Hi, miss. What's your name?
Julie.
Hi, my name's Brady. I'm a paramedic. Can I help you?
Yeah,
Can I see your wrist for a second?
sure.
So what seems to be going on, Julie?
Oh, my stomach hurts so bad.
Okay. Would you be able to have a seat for me, or is
Yeah,
it?
sure.
All right.
Just
Would you
over
be able to sit
here.
over there?
Sure.
Able to come for me?
Oh,
Perfect. Okay. Does that make it better at all? Does it make it worse?
no, it still hurts. Like
Still hurts? Hurts, but doesn't make it worse at all. Like it doesn't.
No.
No? Oh, okay. She's an 8 on the Oxford scale. 8 airway seems okay, breathing seems adequate, and circulation, she has a strong,
Yep.
regular pulse.
Maybe slightly rapid, but
Slightly rapid?
Yep.
Partner, can you give me a set of vitals? I want ECG with a heart rate, SpO2, blood pressure, rest rate, temp, and we don't need a blood glucose, so just this.
Oh God, it hurts.
Oh, we don't need a blood glucose anymore. Alright. Alright, you didn't hit fall at all, did you? You didn't hit your head,
No.
nothing like that? Alright, okay. I'm just gonna take a listen to your lungs if that's okay.
Sure.
Sure? Alright.
Sorry, I'm a bit bigger too.
You're ruining my scene.
We're part.
Alright. I just need you to take a deep breath in for me, okay? Okay?
Yeah.
Deep breath in. Okay.
Crashing out.
Again.
Where's your hole?
Again. I'm just going to do one more step. Deep breath in. And then. Alright. Air entry seems equal and bilateral.
as found.
Lateral, one strong and deep breath sound. I'm just. Let's go ahead and check your abdomen, is that okay?
Yeah, sure.
So I expose the area. Do I notice any redness, bruising?
No.
Is there any herniation, anything like that?
No.
No, nothing visually?
No.
No? Oh, so no pulsatile masses either.
Yeah, you don't see any.
Alright, so I'm just going to press lightly. So if you could tell me where the pain was, where could you point to the pain? Where would you say it is? Right here?
Yes.
Okay, so I'm just going to palpate around your stomach if that's okay.
Okay.
How does that feel?
Fine, but that's my rib.
That's your lip? Yeah, it is.
It's okay, it's hard with
I'm
the
sorry.
belt.
Okay.
Ow. Ow.
Okay.
It's actually more. Ow! Carry on. I just like making Haley laugh.
Alright. Okay, does the pain hurt a little bit?
Yeah, it hurts.
Hurts a little bit, but you'd say up top's worse?
Oh yeah.
Up top's worse. Hurts. Okay, I'm just going to press down here if that's okay.
Sure.
No pain?
No.
Pain? Okay. Have you had any bowel movements recently?
Oh yeah, I took a fat one.
24 breaths per minute.
Okay. And I know this may sound weird, but how was it? Like, how was the color? How was the consistency? Can you tell me?
It was normal.
It was normal and not ordinary at all?
No.
No? Oh, was it larger than normal?
No.
Nope, didn't notice anything.
No? Have you been urinating
Yeah.
regularly? Yeah?
Yeah.
And that's been normal
37.1.
toleration?
37.1.
Okay. You haven't noticed any incontinence, no blood?
No.
Does it burn at all when you pee or anything like that?
No.
Her temp's
No?
37.1.
Temps 37.1.
Blood pressure's
Blood pressure's a little bit on the higher end, but not terrible. It's 50 by 7, which is 6.4. Okay. Hey, on a scale of 1 to 10, how bad would you say the pain was? Because that was a pretty loud scream. A 10?
A 10.
10? Okay. How long ago did this happen? Do you know?
Like 2 hours ago.
2 hours ago?
Yeah.
So does anything make it worse? Obviously, when I pushed down on it, it made it worse, but anything else?
No.
No, just when you apply pressure to it?
Yeah. And
Oh, okay.
it just always hurts.
Okay, gotcha. And what type of pain would you say? Is it throbbing? Is it sharp?
It's a sharp pain.
It's a sharp pain? Pain? Okay. And you say it's worse in the upper right side?
Yes.
That side? Okay. Do you have any allergies at all?
No.
Do you have any medications I should be aware of?
Yeah.
Yeah? Are you the spouse?
Yep.
Would you be able to go give me her med list? Alright. And miss, what would you say you ate last?
I had fries under the bridge.
You had fries under the bridge? Blue
Yeah.
bar?
Hey,
Blue bar
Liz.
fries?
Oh yeah.
Oh, that place is pretty good, isn't it?
It's awesome.
Okay, and how long ago would you say you had that meal?
Like a few hours, like supper time, a few hours ago.
Okay,
Around
so
7 o'clock.
around 7 o'clock. What time is it now?
It is
Nine.
time as is, but it's PM instead of AM.
So it's like 9:30 p.m.
AM.
9.
Or is it
It's
AM?
9, almost 9:50 PM.
PM? Okay, so like two-ish hours ago. Oh, and what were you doing before this? What were you doing before the pain started? Were you just relaxing and that it was sudden?
Yeah,
Have
I
you had it
just-
for a while?
I was just watching TV and then it just came on.
Okay, and it's happened within the last few hours. Do you have a history of abdomen pain at all?
No.
Oh, no, not that you know of? Okay, so.
She says, get some acid reflux and heartburn, but outside of that.
Okay, I got your med list here. Do you mind telling me what the,
I couldn't tell you what those are for. My doctor just told me to take them.
would you be able to
He's,
tell?
Yeah.
Type 2 diabetic, maybe something that's with that, I'm not
The
sure.
metformin is for diabetes.
The
just
metformin's for
oral glycine.
diabetes?
Yeah.
Oh yeah.
Yes, okay.
And,
Oh, yeah.
And what's the Xantu for?
and the Gaviscon and
Gaviscon?
Zantac are just,
Zantac.
yeah, Zantac, they're just antacids
Oh, and they're just antacids, probably for
Gaviscon and the
for her
Gaviscon.
probably
acid
for your
reflux and
abdomen
heartburn.
reflux and your heartburn.
Yeah.
Probably.
Okay, so we're gonna take you to the hospital just to get you checked out. Is that okay?
Sure.
Sandy, would you be able to bring the stretcher over for me?
Sure.
And the patient says, can you give me something for the pain?
Yeah. I
Got
had
any
something.
morphine?
Yeah, we can give you some medication. So I'm going to consider
Any
analgesia for
morphine?
the. Are we allowed to administer morphine?
Not as a PCP.
Okay.
Eventually though, it's coming.
As an ACP, you will.
Yeah.
Is
Oh,
So
it
we
hurts so
so we won't be
bad.
able to give you morphine, but we'll give you something for the pain.
Do you want to sit up or
gravel?
lay down?
I don't got more
Sit
for you, I
up.
got gravel.
You want to sit up?
Yes, please.
Okay. And do you think you'd be able to walk over for me?
Yeah.
Yeah. Do you want assistance at all?
No.
No. You're fine on your own.
Yeah.
Fine. Okay. Okay. You can come. You have a seat. Can you put your feet up for me? Alright, so we're gonna have to do this kind of make it happen.
You want a blanket out of?
Sure.
Alright, are you comfortable? Or as comfortable as
Yeah.
you can be?
Yeah. As
Yeah.
comfortable as I can be.
Do you want a pillow or no?
No.
So now that you moved on a scale of 1 to 10, how would you say your abdomen pain is?
A 10.
Still 10? It hasn't gotten better?
No.
Or no? So we'll get you that analgesia in the truck. Alright. Did you have any plans today, Judy? Julie.
Really. No, not now. The day's over.
Hey, day's over? Yeah, that's fair. What time do you usually go to bed?
Like
No.
midnight.
Midnight? That's pretty late. Why stay up so late?
Gotta watch my show.
What's your favorite show? I'm going to try to
We'll say The Office.
The Office? Yeah, that's a pretty good show. Who's your favorite character?
I don't know the characters.
Oh my
The
god.
main character, obviously.
Jim.
Jim.
We'll say Jim.
It's Michael or Dwight.
Yeah, okay. Does that hurt your abdomen at all, the straps?
No.
No? Okay, so we're going to lift this to standing height. Ready? All three. 1, 2, 3. Is all the way up? We can go a little bit higher.
I think it is.
You got one more.
Yeah, we got one more. Alright, we're going to go one more time.
I'm sure.
Ready? 1, 2, 3. There we are.
And I can't believe you laughed at that, Sandy.
Sorry, I couldn't help it.
Have you ever been in an ambulance before, Julie?
Nope.
Yeah, I broke my wrist when I was like
Oh.
5.
Big job.
Yeah,
Yeah.
that's good.
Okay, you're locked in.
Oh, all right, we're going to raise it up.
Yeah.
You ready? On 3. 1, 2, 3. All right. Thank you, Sammy. All right, there we go. Can you bring me the bag, which you're already on, first step. And we're going to go on the wheel, so can you load them up into the trunk?
You got it, pal.
And 4 rubber duck.
I'm going to run another blood pressure. And partner can do something else for a patch. I'm going to go transport. I'm going to go code 3, C-test 3, so I'll do pair 3s.
Okay.
And partner, when you have the patch ready?
Yep.
This is Lambton Hospital, go ahead.
Hi, this is truck 138, incoming in C-test 3, transport code 3, with a 56-year-old female patient with a severe abdomen pain as a chief complaint. Vitals are as follows: heart rate 101, SpO2 97, rest rate is 24. Her blood pressure is currently 136 over 85, and her ECG looks normal. She is type 2 diabetic, and she does have medication for acid reflux. ETA about 5 minutes from the hospital. How do you copy?
10-4, C triage, nurse on arrival.
Thank you very much.
All right.
Good job.
Yeah, that was good. One question. Would you do a blood glucose on this patient being a type 2 diabetic?
I would.
Yeah. On the diabetic, I should have, but.
So there could be
But-
diabetic
I should change that.
ketoacidosis.
My bad.
Yeah, that's a great consideration, yeah. And it's not high blood sugar, it's not low blood sugar, it's high blood sugar, and most type 2s will present high.
Right.
So here's a great point, guys. If you ever have a type 2 diabetic, right, and their glucose level is low,